Good afternoon. It's Friday, the 13th of May, 2022. And earlier this week, the Care Quality Commission published their report on the inspection of North West Care Co-Operative that carried out earlier this year. You can find the inspection report on the Care Quality Commission website. If you go to the new website and you look under Find and Compare Services, enter into the box North West Care Co-Operative Chester, and you should find this report. As you can see, we're graded overall is good, with the gradings for each category, safe, effective, caring, responsive, and well-led, also graded as good. You can click and see a brief summary of the inspection, which I will read to you now, and there is a fuller report that you can read at your own leisure. So in terms of the latest inspection summary, this inspection was carried out earlier this year, and was the first, as I say, since being registered in 2019. CQC gave us a short period of notice for the inspection, and this was because we needed to seek consent to visit people and speak to them about their views of the service. Inspection activity started on the 21st of March and ended on the 5th of April 2022. Before the inspection, the CQC reviewed information that they had received about the service since it was registered. They also used the information that we sent them in the provider information return that we were required to complete annually. During the inspection, the inspectors spoke with 4 people who use the service and 2 relatives about their experience of the care provided. They watched a video from one person who had been unable to meet in person but wanted to share their views. They also spoke with 5 members of staff, including the registered manager and a number of personal assistants. They reviewed a range of records, including 3 people's care and support records and 2 medication records. They looked at 3 personal assistance files in relation to recruitment and supervision. A variety of records relating to the management of the service, including policies and procedures, were reviewed. About the service. North West Care Co-Operative Chester is a domiciliary care service which provides care and support for its members. Members are people who receive direct payments or personal health budgets, either for their own care or for the care of dependents. People using the service receive care and support from personal assistants. The service was providing support to 16 people at the time of the inspection. Not everyone received personal care. CQC only inspects where people receive personal care. This is help with tasks related to personal hygiene and eating. Where they do, we also consider any wider social care provided. People's experience of using this service and what we found. The service was able to demonstrate how they were meeting the underpinning principles of right support, right care, right culture. Right support. People were supported to have maximum choice and control of their lives, and personal assistants supported them in the least restrictive way possible and in their best interests. The policies and systems in the service supported this practice. People had a choice in who supported them and when their support would be provided. Personal assistants knew people well, and trusting relationships had been formed. Personal assistants supported people to take part in employment and education opportunities and to pursue leisure interests in their local area. Right care. People received kind and compassionate care. Personal assistants protected and respected people's privacy and dignity, understanding and responding to their individual needs. Right culture. People led inclusive and empowered lives because of the ethos, values, attitudes, and behaviours of the registered manager and personal assistants employed. People received good quality care and support, and because appropriately trained personal assistants could meet their needs and wishes. People receiving support and those important to them were involved in planning their care. For more details, please see the full report, which is on the website, and I'll show you how to find that in a moment. Rating at last inspection, as the service was registered with the CQC on the 4th of March 2019, this was the first inspection. CQC made 2 recommendations about the recording of prescribed medicines and a recommendation about documenting training records. They will continue to monitor information they receive about the service until we return to visit as per our re-inspection programme. If they receive any concerning information, they may inspect sooner. And you can see here, if you click on this link, you can publish the full report, which is available there to you to read, but I'm not going to go through with that now. So that's our CQC inspection for this year. I think generally very pleased with that, a good inspection report to get for our first inspection. And we look forward to working on those recommendations and to a visit from the inspectors when they're next due, which we think will be some way off yet. Thank you very much.